All right, y'all. My topic is cirrhosis, and there's quite a bit to learn. So, first, we'll talk about what a healthy liver does. So, it produces bile, which is necessary to digest fats. It manages blood coagulation, metabolizes proteins, fats, and carbs, manufactures cholesterol and albumin, detoxifies poisons, which are alcohol, nicotine, and drugs, and it converts ammonia to urea. There's a picture of your liver. The pathophys is a cirrhosis is a degenerative disease of the liver in which the lobes are covered with fibrous tissue and the lobules are infiltrated with fats. Down here, this little chart kind of tells you the percentages of the types of cirrhosis that people get. There are 5 different kinds of cirrhosis, and we're going to go over all of them. The cause of cirrhosis is not always known. So the first one we're going to go over is alcohol-related liver disease. This happens with heavy alcohol consumption. So this does not always cause any symptoms until the liver is severely damaged. So you got to be drinking for a while and a lot to actually get liver cirrhosis from drinking. Each time the liver filters alcohol, some of the liver cells die. The liver cannot develop new cells, but prolonged alcohol abuse can reduce the liver's ability to regenerate. For women, ingesting more than 2 to 3 alcoholic drinks per day increase their risk for developing this. And for men, it's 3 to 4 drinks a day. There are 3 main stages of alcohol-related liver disease, and the first stage is alcoholic fatty liver disease, and this is reversible. Stage 2 is alcoholic hepatitis, and this is binge drinking. This is drinking a lot of alcohol in a few short days. This is reversible if you stop drinking permanently. And stage 3 is cirrhosis, which is significant scarring and it's irreversible. I'm going to go over some of the characteristics that you'll see because they all kind of go hand in hand. So we'll hit that at the end. Next is post-necrotic cirrhosis, and this occurs worldwide. This is necrosis of liver cells, regeneration of hepatic tissue, then the formation of large bands of connective tissue, which are coursed irregularly through the liver, so it causes it to be damaged. This usually happens with hepatitis C, but it can also be from B and D. And this also happens with exposure to hepatotoxins such as industrial chemicals, drugs, and medications, and from infections. The factors which determine whether cirrhosis occurs following acute infectious hepatitis, as well as a variety of cirrhosis that develops for this, is still unknown. Biliary cirrhosis is pretty rare. It happens less than 200,000 people per year. I put this picture down here because it can happen with cystic fibrosis. So if you look at that photo, there are some reasonings in there, especially in the gallbladder and the liver area. This results from destruction of the bile ducts as a result of inflammation. And it also, results from damage to the ducts that lead to bile backing up into the liver. So there's 6 points right there that will tell you why biliary cirrhosis happens. There's also 4 stages of this as well. And the first stage is portal inflammation, that is with or without florid bile duct lesions. Stage 2 is increase in size of the periportal lesions with interface hepatitis. Stage 3 is distortion of hepatic architecture with numerous fibrous septa. And stage 4 is cirrhosis. Then we have cardiac cirrhosis, and this usually results from right-sided heart failure. So there's a photo down below that shows some signs and symptoms of that. This hepatic disorder that occurs secondary to hepatic congestion due to the cardiac dysfunction, especially in the right heart chambers. This condition may present with shortness of breath, paroxysmal nocturnal dyspnea, which is shortness of breath when you're sleeping, so you wake up gasping for air, orthopnea, and leg swelling. And this causes an increase in the venous congestion and increased pressure of the hepatic sinusoids. And then we have non-alcoholic fatty liver disease, which results from fat building up in the liver. Most people don't have symptoms, but in rare cases, people may experience fatigue, pain, or weight loss. This is growing as the years kind of go on because the obesity population is also growing. So this is also associated with diabetes, CAD, high cholesterol, gastric bypass surgery, and the use of corticosteroids. Over time, inflammation and scarring may occur, so this can lead to cirrhosis. It's a chronic disease, which means it can last for years or it can just be lifelong. Treatment can help, but it's not going to be cured. And there's no standard treatment that exists for this. So doctors are mainly going to treat the underlying condition, which would be the obesity, diet change, things like that. So I'm going to go over some characteristics first before I hit clinical manifestations. The early stages of cirrhosis, we're going to notice firmness of the liver. It's going to be pretty easy to palpate because it'll be sticking out. Some generalized weakness, malaise, which is the general feeling of discomfort. And then there will be some vague like flu symptoms. So those are early stages. Some of the later stages include upset stomach, ascites, which is the swelling in the abdomen, jaundice, which is the yellow skin, which you can see in this photo below in his eyes. And then there's also some more feeling of malaise in there. So complications of cirrhosis is going to kind of go along with these clinical manifestations. I got to move my own camera. So they're going to show differently. This is why I explained it, of what you're going to see depending on the stage that they're in. Early stages, it is firm, easy to palpate, and those are some manifestations of the later stages. Some of the complications are going to be fluid retention and esophageal varices, which are the veins in the esophagus that become enlarged and engorged, and hepatic encephalopathy, which is the brain damage caused by liver disease and ammonia intoxication. So some nursing assessments, some of the subjective data that we're going to see is right upper quadrant pain due to where the liver is located, fatigue, poor appetite, nausea, and itchy skin. And objective data is easy bruising and bleeding, confusion or memory loss, jaundice skin coloring, dark colored urine, dependent edema, and ascites. Some of the diagnostic tests that can be done include a complete blood count, and they're also going to do a liver function test, and in that liver function test is ALT, AST, LDH, and the GGT. We can check protein levels, prothrombin time, and ERCP is the endoscopic retrograde cholangiopancreatography. We can do a liver biopsy, which pull a piece of the liver off, take it to the lab, do a biopsy on there. And you can also, sometimes a paracentesis might be done because of the ascites in the stomach, and so we can pull out some of that swelling. Medical management is going to be pretty hard for some people if drinking is what they know. So we're going to try to eliminate alcohol use, have some diet modifications, which would be cutting the salt out of diet and not including adding salt to foods on the top. especially because, people cook with food and then they add more salt on top. So we got to try not to do that. Taking a diuretic to try to get rid of some of that fluid that we're retaining. Potential antibiotics, avoid alcohol and meds that can harm the liver. So we can try to help people get to AA meetings and things like that. Weight loss and management of metabolic factors. Eating less of certain foods, which is going to include red meat, cheese, and eggs, and protection from infection. So we can also, when I said itching, we can give these people Benadryl, but it kind of has to be within a certain range because Benadryl can cause some liver damage if we give too much. We can also give antiemetics for nausea and heartburn if they're having that, and Dramamine kind of goes hand in hand with the Benadryl to just stop the itching and the nausea as well. Nursing interventions. That's just a no smoking. So we're going to have to monitor vital signs pretty closely, monitor for GI bleeding, and monitor fluid status is going to be pretty big. So we're going to have to do INOs, daily weights, make sure these people aren't retaining the fluid and that we're actually getting it out of their systems. Direct people to resources to deal with alcoholism. So like I said, we can send them to AA or if they'll go. Provide a lot of education, just like we just went over. Monitor their lab values. We need to make sure their ALT and AST, the liver function tests, are coming back okay and they're not going down or going up. And place the patient on bleeding precautions as appropriate. So here's some more patient teachings. We'll measure dietary intake by calorie counting. And when we send these people home, we can kind of teach them how to do this by reading labels and checking salt on cans, not eating canned foods. Weigh as indicated. So these people are going to want to check their weights every day. Same time, same amount of clothes, same scale. Encourage patients to eat and explain the reason for diet types, because some of these people, once they get put on a diet, they're just not going to want to eat, or they might be in pain from the esophageal varices, so they can't swallow too well and it's going to hurt. So if that's the case, we'll encourage them to eat small, frequent meals instead. Restrict the intake of caffeine, gas-producing or spicy and exclusively hot or cold foods. Encourage frequent mouth care. And that's for the esophageal varices. Promote undisturbed rest periods. So your gut can rest, the liver doesn't have to work so hard to break things down. Recommend cessation of smoking. That also goes with drinking. Maintain NPO status when indicated, which goes along with letting the gut rest. Provide tube feedings, TPN, and or lipids if indicated. Some of these people are going to have NG tubes, so we can let the stomach rest and the liver rest so they're not breaking things down consistently. So just make sure that NG tube is working properly, make sure it's placed properly, the suction's on if it needs to be on. In these patient teachings as well, we want to teach them some signs and symptoms just in case complications arise. And if their partner's noticing something as well, they can bring this up. So this can progress from inappropriate behavior to disorientation. And there can also be astrixis, which is a flapping tremor, usually happens in the hand or in the elbow area in the wrist. And it'll be twitching of the extremities. And this can pretty quickly change into stupor or into a coma. So we kind of need to make sure these things aren't happening and tell somebody if they are. A lot of the treatment is going to come from supportive care and preventing further damage. So we really need to push not drinking, smoking cessation, changing the diet, things like that. The prognosis is good if you're in stage 1 and 2. So these people don't show symptoms, and the life expectancy is around 9 to 12 years. If it's caught excessively early and diet changes and everything else changes, their prognosis is pretty good. A person can remain asymptomatic for years, although 5 to 7% of which with cirrhosis will develop symptoms every year. So they kind of just keep building if there's no changes in that person's lifestyle. And then there's decompensated cirrhosis, which is your stage 3 and 4. And these people experience the symptoms and complications. They have them. They're getting jaundice, they have ascites, all the complications that we went over. Their life expectancy is greatly reduced, and experts recommend referral for liver transplants. But if they've had these initial visits with the doctors already and they're told to change their diet and do all the things they're supposed to do to make that liver healthy and regenerate, they don't get put on the list for a liver transplant because it was kind of their choice. And there's other people who can't do much about, like the non-alcoholic fatty liver disease, and it just kind of builds. So we want to take care of ourselves as much as we can.